my name is Katie. I'm going to be the nurse doing a head-to-toe assessment on you today. Can you tell me your name and your date of birth?
My name is Gavin Winslow, and I was born on March 8, 2001.
I'm just going to wash my hands real quick. And we're going to start by doing inspection of your face. And can you smile for me? All right, and it seems to have facial symmetry on both sides. And can you stick out your tongue? Appears to be midline. And can you say ah for me?
Ah.
Right, and his uvula did go up, which is normal. And so we're going to start by looking at his any lesions on his face. He doesn't seem to have any, and we're also going to assess skin turgor on his neck. And he had no tinting there, so that means that he has adequate fluid status. And his eyes have been opening up spontaneously. He seems to have no sign of ptosis. His sclera is white. His conjunctiva is pink and moist. And we are going to do 2 eye exams. Can you look forward for me? Alright, and both of his pupils constricted on each side when I put the light in his face. And can you follow my finger? Alright, it was Perla, so his pupils were round and reacted to light and equal and accommodated to my finger. And so now we are going to ask again what his name and his date of birth are. So can you tell me?
My name is Gavin Winslow, and I was born on March 8, 2001.
And what are we doing and where are you right now?
We are in my apartment, and we are doing a head-to-toe assessment.
Right, perfect. So it is alert and oriented × 4. And now we are going to palpate his skull. And we're looking for any lumps or bumps. Do you feel any tenderness right now?
No.
All right. We're going to feel his ears. Any tenderness?
Mm-hmm.
We're going to feel his sinuses. His frontal, ethmoid, and maxillary. And did you feel any tenderness there? I didn't feel any masses when I was going through that. And now we're going to palpate his lymph nodes. We're going to start with the parotid lymph node, preocular, postocular, occipital, submental, submandibular, superficial cervical, deep cervical, posterior cervical, and supraclavicular. And did you feel any tenderness during that?
Mm-hmm.
I didn't feel any masses when I was doing that, so that is good. And then now we're going to inspect his thoracic cage. It seems to be symmetrical. His shape, he has his address work breathing at the moment is normal. His AP diameter is 2 to 1. And now we are going to palpate the area. Do you feel any tenderness here?
Mm-hmm.
No masses or anything?
Mm-hmm.
All right, perfect. And now we're going to perform symmetrical expansion. So I'm going to ask him to breathe through me. Right? And my hands did go out equally on both sides. And now we are going to, can you turn around? We're going to perform the costovertebral angle tenderness. So we are going to locate where I would put my fist here and then hit, fist here, hit. Did you feel any tenderness there?
No.
No. So that means that his kidneys are not inflamed at the moment. And now we are going to auscultate his respiratory sounds, doing the creak key pattern. And I see you take a breath, but you don't really have to breathe when I place my stethoscope in each area, okay? Alright, and his lung sounds were clear to auscultation. There was no adventitious sounds on this area. And then I would do this on the anterior side in real life, but at the moment we are not going to do that in this video. If you can turn back around. Alright, so we are going to inspect his precordium now for any pulses, lifts, or heaves. And he doesn't seem to have any. We're also going to palpate his pulses now. It's going to have your arm. So we're going to look for his brachial pulse, radial pulse, his femoral pulse, his popliteal pulse, posterior tibialis pulse, and then we'll look for the pedial pulse. And we would have him lying down so we would be able to feel the pedial pulse on like a bed with the thing out. And I would grade those pulses a +2, which is normal. And then we are going to assess his capillary refill now. So, and it came back in less than 3 seconds, which is normal. And then we're also going to assess skin turgor again on his hand. And there was no tinting, so he has adequate fluid status there as well. And then we are going to auscultate his cardiac sounds now. You can lift your shirt. So we are going to start with the ape man, so we're going to start with aortic here. Pulmonic. Herb's point. Tricuspid. And then mitral. And all those sounds were normal. His rate and rhythm were normal. And now we are going to locate the PMI. Can you go again? So we're going to start the sternal ankle, find the second, this is the second rib right here. We're going to find 3, 4, and 5. And we're going to do it at the 5th intercostal space, and we're going to go mid-clavicular line. So we put our stethoscope here, and we would listen. Once again, it was a regular rate and rhythm there. You're good. And then we would do this again. We would do it on the bell side of the stethoscope, and I would listen for any murmurs in both spots. I would do it, and I would do this 3 times with left side lying, supine, and sitting upright when I would be listening for the murmurs. And now we are going to auscultate his carotid arteries. Alright, and we're listening for any bruise right now. We're only taking one at a time so we don't include any blood flow to the brain. And now we are going to do the gastrointestinal section of this. So can I have you lay down? Okay. Okay, and I'm going to have him lie supine. Can you put your feet up? And then I would make sure, did you empty your bladder recently?
Mm-hmm.
Perfect. So then we're going to inspect his abdomen region. So I'm going to lift the shirt up for a bit. And his contour shape seems flat. He seems to have no lesions, no ostomy bag, no wounds on his abdomen region, and seems to be normal. We're going to start, that was the inspection, so we're going to start with auscultation next. We're going to listen for bowel sounds in each quadrant. We're going to start with the right lower quadrant first. Alright, and there were bowel sounds present in all 4 quadrants, so it would be normal, active, and you would do it times 4 for all 4 quadrants. And now we are going to do percussion on the abdomen region in all 4 quadrants as well. So we're going to start here in the right lower quadrant. And there was timpani heard around the abdomen region, which is what you normally hear. And then now we're going to do palpation. So we're going to start with light palpation in the right lower quadrant, which is about 1 to 2 centimeters. And do you feel any tenderness there?
No.
All right, we're going to do deeper palpation, 5 to 8 centimeters down in the right quadrant. All right, did you feel any tenderness there as well?
Mm-hmm.
Perfect. All right, and then can I have you sit back up? So now we are going to inspect his muscle area, and so we're going to feel his hair distribution seems to be normal on each side. He doesn't seem to have any lesions. His skin is normal, and we're going to feel on both sides. The muscle shape seems to be symmetrical on both arms. And now we are going to do the hand grip test. So can you please grip both my hands, please? Squeeze. All right, and muscle strength was the same on both sides. And now we are going to do the pedal push on his lower extremities to feel the muscles there. Can you put your feet here? And push. Okay.
Okay.
Yeah, well, the muscle strength was good on both sides.
Thank
and
you.
that concludes the head to toe assessment.